Hello, my dear listeners, and welcome back to the Kapeel Gupta Career PodShow. And today, I want you to imagine a young student sitting in a hospital waiting area watching two very different scenes at the same time. On one side, a doctor is trying to save a life. On the other side, a family is worried about cost, access, insurance, and whether the treatment they need is actually affordable. And that is where a powerful question is born. Who decides how limited health money should be used in the smartest possible way so that more people can live healthier lives? So that is where the career of a health economist enters. A health economist studies how money, policy, data, and healthcare decisions come together. The World Health Organization says health economics work includes health technology assessment, benefit package design, and economic evaluation, all of which help policymakers use limited resources more efficiently and introduce economic evidence into health policy. In simple words, a health economist helps answer tough, real world questions like which treatment gives better value, which health program should be funded first, and which medicine, device, or intervention is worth the cost for a whole population. So, this is not a career for someone who only likes numbers in a classroom. It is a career for someone who wants numbers to improve lives, and it is where economics stops being just theory and starts affecting hospitals, medicines, vaccines, insurance systems, and public health policy. Hi, I'm Kapeel Gupta, career coach, life mentor, and founder of Study Abroad Academy. I empower students, parents, and conscious professionals to design a fulfilling life and career by aligning their minds, values, and aspirations. And I do it with coaching, mindset work, and the game changing power of graphotherapy because students deserve more than just guidance, they deserve transformation. So let us first talk about scope because that is where a dream becomes practical. In India, the scope for health economists is becoming stronger because the country has built an official system for evidence based health decisions. Health Technology Assessment in India is an attached office under the Department of Health Research, Ministry of Health and Family Welfare. HTAIn says it evaluates the clinical effectiveness, cost effectiveness, and safety of medicines, devices, diagnostics, procedures, and public health programs to support evidence based healthcare decisions. Now, its manual also says it works through a network of resource centers across the country to review and evaluate technologies from the perspective of both clinical effectiveness and cost effectiveness. That means in India, a health economist can work in HTA units, public health institutes, research centers, state and national policy projects, insurance linked work, consulting, NGOs, universities, and increasingly in pharma and HEOR type roles. Now, WHO India says in March 2025 that health technology assessment is reinforcing India's commitment to inclusive, affordable, equitable, and accessible health for all. So, this is not a side field anymore. It's becoming part of how India thinks about health policy and health spending. So, yes, the scope is real. In India, the field is tied to public policy, affordability, and health system design. Internationally, it stretches across policy, academia, pharma, health technology assessment, insurance, and outcomes research. And now, let us make the job feel real. Imagine you're a health economist working on a new cancer medicine. A company says the medicine is promising. Doctors say it may help. Patients want access. But the big question is it worth the cost at a population level? A health economist helps answer that by comparing costs, outcomes, alternatives, and the likely impact on the health system. Now, HTAIn's own description says it looks at clinical effectiveness, cost effectiveness, safety, and broader issues to inform policy. WHO also frames health economics around economic evaluation and introducing evidence into health policy. So, on a normal day, a health economist may analyze data, compare interventions, build models, work on cost effectiveness studies, estimate value for money, support reimbursement decisions, or evaluate which health package should be prioritized. At higher levels, the work can include policy briefs, benefit package design, health financing strategy, or advising governments and institutions on where scarce health resources should go. Now, that picture is directly supported by WHO's health economics work on HTA and benefit package design, plus HTAIn's official mandate. Now, the work environment can vary a lot. Some health economists work in universities and research centers. Some work inside ministries, HTA bodies, or public health institutions. Some work in consulting or the pharma ecosystem under HEOR, is Health Economics and Outcomes Research. Others work in global health, insurers, or not for profits. Now, that spread is a grounded inference from the kinds of programs, centers, and salary titles visible across WHO, HTAIn, York, UCL, Monash, and HEOR salary listings. Now comes the important student question. How do you become one? So the honest answer is that there's usually no single undergrad degree called health economist. Most people enter the field through a strong base in economics, public health, statistics, demography, medicine, pharmacy, epidemiology, or related health and policy disciplines, and then specialize. University of York's MSc in Health Economics says the field helps make difficult decisions about prioritizing resources and prepares graduates for careers in research and health service decision making. UCL's MSc in Health Economics and Decision Science describes itself as an applied economics degree spanning economics, epidemiology, and statistics. LSHTM LSC's MSc in Health Policy, Planning and Financing explicitly include health economics as a core area. For Indian students, a smart route can be this. After class 12, build a strong base through economics, statistics, public health, pharmacy, medicine, life sciences, or a quantitative social science route. Now, then specialize through a master's, diploma, or focused training in health economics, health financing, or HTA related work. In India, PHFI's Center for E-Learning offers a one-year e-postgraduate program in health economics, healthcare financing and policy. PGIMER School of Public Health says it introduced an online health economics course and has roles such as senior demonstrator in health economics, which shows active teaching and institutional demand. IIPS offers strong quantitative population and health linked training through programs like population studies and biostatistics and demography, which can be useful pathways into this field. And if we talk about strong universities abroad, a few names stand out clearly. University of York offers a dedicated MSc in Health Economics and is one of the most visible global names in the world. UCL offers MSc Health Economics and Decision Science. LSHTM and LSE jointly run MSc Health Policy, Planning and Financing, which includes health economics in a serious policy setting. Monash offers a Master's of Business, Economics and Health, and a PhD route in health economics. University of Melbourne offers a health economics and economic evaluation stream within public health. Now, these are all strong current official pathways. As for skills, you need more than just being good at maths. You need economics thinking, comfort with data, policy sense, analytical writing, and the ability to compare alternatives logically. Health economics programs also make it clear that statistics, epidemiology, evaluation methods, and health systems understanding matter a lot. In simple language, this career suits the student who can look at a health problem and ask what works, what costs, and what gives the best value. Now, let us talk about money. So, I want to be very honest here. Salary data for the exact title health economics is a little uneven, especially in India, because many people in this field work under nearby titles such as HEOR analyst, health financing specialist, HTA researcher, or policy economist. Glassdoor's India page has insufficient data on it. A more useful related benchmark is Health Economics and Outcomes Researcher, where Glassdoor India shows an average of about 14.5 lakhs per year with a broad reported range. Now, that gives a better sense of how specialized private sector and pharma linked roles can pay. Abroad, the numbers are much stronger. Glassdoor currently reports average annual pay of about $167,000 in the United States for health economists and about £45,000 in UK and about 81,000 Canadian dollars in Canada. For context, the broader US economist benchmark from BLS is $115,000 median annual pay in May 2024. So this is clearly a serious specialist career, especially when combined with strong quantitative skills and policy or outcome research experience. So, yes, this can be a well paid career, but like most high value careers, it rewards depth. The students who do well here are usually the ones who build a real mix of economics, health systems, data, and policy understanding. So, what should you remember from today's episode? If you're a student who likes economics but also wants meaningful work, or if you like public health but also enjoys analysis and policy, then this could be a very powerful path for you. It is modern, it is intellectually rich, it matters in India, it matters globally, and it gives you the chance to work on decisions that affect millions of lives. And now, let me speak directly to the student or parent listening to this episode. If today's episode on Health Economist opened your mind to a career you had never seriously considered before, imagine how many right fit careers may still be hidden from you. The truth is, the right career is not found through guesswork, pressure, or random advice from people around you. It is found through clarity. If you're confused about your career path, your subject choices, your college roadmap, or your future direction, connect with me for my career counseling program. I help students understand their strengths, identify careers that truly fit them, and move forward with confidence. So message me today and let us find the career path that is truly meant for you. Your dream career was never lost. It was simply unread. So let us decode it together.